Good morning, everyone. We will wait just a minute or so while everyone gets logged into Zoom for the webinar. Good morning, and thank you for joining us for this webinar for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on August 13, 2021, and is scheduled to run from 10 a.m. until 11 a.m. And with that, I would like to welcome the Director of the Early Learning and Care Division, Stephen Profiter.
Thank you so much, Mai. So as Mai mentioned, my name is Stephen Profiter. I'm the Director of the Early Learning and Care Division at the California Department of Education. It feels like it's been a minute since we've had a webinar in this series, but I'd like to welcome back those of you that previously joined us for our bi-weekly ELCD webinars, and welcome any new contractor staff or participants that we may have beginning this program year. As you know, this has been an historical year for the early learning field with the transition of certain programs to the Department of Social Services and the incredible investment that was made to bring California closer to universal pre-kindergarten through significant investments in both transitional kindergarten and state preschool. Not to mention, we are still not through the COVID-19 pandemic, with the Delta variant making things more challenging. And just with that, please, we just will remind you, as we've done in our past webinars, please remember to wash your hands, wear your masks, and get vaccinated. We have the tools to protect our children, particularly those that are not yet eligible to be vaccinated, as well as our communities. We just need to use the tools. Before we move on, I'd like to share that the purpose of this webinar series moving forward and some upcoming changes that we're anticipating in the division. First and foremost, I want to explain that due to the transition of certain programs to CDSS, these webinars hosted by CDE will only include information and guidance for California state preschool programs. While we appreciate that many of the requirements for programs at CDSS are the same or are similar to CSPP requirements, we want to make it clear we don't have the authority to address questions related to programs that are no longer administered by CDE. In terms of the schedule for these webinars, we're planning to hold these webinars monthly to keep you all up to date with any changes and to provide an opportunity for contractors to ask questions that you all may have. We'll monitor the need to adjust the frequency of the webinar series, or perhaps webinars on specialized topics as we work through things like budget implementation, guidance, and the continued pandemic response. We also have some exciting new possibilities coming up as Universal Transitional Kindergarten, Universal Pre-K begins to roll out. So keep a lookout for CDE's upcoming P3 webinar announcements and newsletter. We're really excited to have you all back joining with us, and just continue to appreciate everything that you do as things We thought we were beyond the peak of this pandemic, but we know that many of you are certainly experiencing similar effects as you'd experienced during what we thought was the peak. But without further ado, we've got a lot to cover this morning. I'm going to invite Virginia Early to introduce herself.
Thanks, Steve, and so nice to have all of you back with us for another ELCD webinar in this new world we're all living in together. I'm Virginia Early. I'm the administrator of the policy office in the Early Learning and Care Division. For those of you that don't know what that means, it means I work on I and my team work on all of the budget and legislative pieces, as well as guidance and regulations, which we know are hot topics for many of you, and we'll be covering a lot today. So given the amount, I'll now turn it over to Alana, who will be our moderator.
Good morning, everyone. I'm Alana Andrade, and I'm a child development consultant here at Early Learning and Care Division, and I'll be your moderator today. To help answer your questions and to make this webinar run smoothly, we have a great team. From the policy office, we have consultant Danielle Davis and office technician Mai Dao. From the program quality implementation office, we have education administrator Crystal Devlin and consultants Cassandra Lewis and Richard Miller. From the child development, nutrition, and fiscal services, we have managers Andrea Johnson, Alan Lynch, and Kate Washington. From the data research and planning office, we have the data research manager Jane Lian and analyst Rob Hom. And from the director's office, we have analyst Brianne Rude. You might have noticed that our wonderful Q&A team is smaller, although just as mighty. We ask for your grace in responding to your questions, and as always, the team is committed to being as responsive as possible. And always note that we may not be able to answer every question. Just also a reminder that our chat box is disabled. We will be able to share links with you there, but you're not unable to chat with us. Please utilize the Q&A feature to ask us questions. Also, when you ask us questions, do give us as much detail as possible before clicking the submit button. Do not feel the need to rush to get your question into the queue. It's okay to take a moment to accurately type out your question before you click send. Back over to Stephen to speak about the agenda.
Thank you, Alana. So let's take a look at this morning's agenda. So we've got some items from the policy office and the fiscal team where we'll provide some updates on what's in the various budget related items. There's a lot. The program quality and implementation office has some updates on reopening and reimbursement, some non-COVID-19 related closures and some notices of action. And finally, CDMIS team has some information about updates made to a CDMIS reporting field. As Alana mentioned, while we work through questions in real time, as we're doing now, we'll take some of these questions that are submitted through the Q&A function and address those out loud. As a result of the transition, we are working with a little bit of a smaller team than we have had on previous webinars. So, but as always, we're committed to doing our best to answer as many questions as possible and to take any unanswered questions back to post them as FAQs on our website. And you've heard us mention a couple times about the smaller team. I did want to talk a little bit about a staffing update. And so if we can go to the next, perfect. So we are currently, facing some staffing impacts after the transition. While the majority of the former ELCD team has been transferred to CDSS as a result of the transition, we are currently working with not just a smaller team, but we are continue to advertise, recruit, and fill new positions that came to CDE just to really ensure that we can continue doing our work. We want to be transparent with you all that we are doing our best to keep providing guidance and technical assistance, but it's important to note that our staffing is somewhat limited as we are working to fill additional positions. So in short, I guess we're asking for a little grace until we are fully staffed, or more staffed up, I should say. We do have some job openings coming up in a few of our offices in the Early Learning and Care Division, and we're encouraging anyone with those with field experience to apply to ensure that we've got the best applicants that understand the early learning field and are excited about implementing universal pre-K. So we've got some job openings in our PQI office. So those are the regional consultants who work directly with contractors to support contractors and provide technical assistance. We have openings in our policy office. So these are the folks that work on bill analyses, provide technical assistance to the legislature for budget and bill related items, as well as developing regulations. And then finally, we have some consultant openings in our early education system improvement office who work on systems pieces and P3 alignment, as well as some positions that will support TK implementation or the UPK implementation. So we encourage you all to apply or pass on the job postings as they are released that you think, for folks that may be qualified or interested in the positions. So just a little bit of background on like how to do it, right? So there are, the state isn't without its processes. So there are a couple of steps to apply for a state consultant position. So first you've got to be eligible to apply, right? And that involves taking an exam. So the exam for the consultant position is basically a checklist of candidate experience along with the resume filled out on a state form and documentation of other requirements such as transcripts. In order to apply for jobs with a specific title, you'll need to have taken the exam first for that title or job classification. And then there's a link that I think Danielle put in the chat about the actual the child development consultant job requirements, the steps, and such. Then the applicant must actually apply for the position by submitting the application on their CalCareers account. If you don't have one, you'll need to set one up. And then a current listing of the positions openings at CDE. So this is not just the Early Learning and Care Division, but any announcement that we make about an opening for a child development consultant would be found on the CalCareers page. And I think we're going to drop the link to that page, which is filtered by Department of Education positions also. And we're also working to get our positions posted to LinkedIn. So and just I'll wrap it up with this. Just with all of your help, we can work to ensure that we've got the best team possible that is ready to implement universal pre-K and support programs. And so now I'm going to invite Virginia and Kate to talk us through some of the budget items.
Awesome. Thank you so much, Steve. And just a real plug for anyone that thinks they might be interested in joining us. We'd be happy to have you and answer any questions you may have about that. So let's talk about the budget. So starting with state preschool, the California State Preschool Program 2021-22 budget changes. The budget and the trailer bill associated with the budget made a lot of changes to state preschool. So Assembly Bill 131, which is the Child Development Trailer Bill, did a couple of things. First of all, it holds state preschool contractors harmless for 21-22. So for this year, direct contracting state preschools are going to be reimbursed at 100% of the contract reimbursable amount or net reimbursable program costs, whichever is less. And that requires you to be open and providing services, and we'll talk a little bit more about that later when Crystal gives her updates on some of the nuances. There's also a piece in the budget on changes to the state preschool reserve account policy. So the trailer bill eliminates the 10% reserve set aside for professional development for state preschool staff. And it retains that the fund balance be equal to 15% of the MRA or 2,000, whichever is greater. And then finally, for the purposes of this slide at least, there are changes to waive family fees for all state preschool families through June 30th. 2022, so for fiscal year 21-22. We're currently working to develop a management bulletin for family fees, and we'll release it as soon as it's finished. And from the fiscal perspective, I'll turn it over to Kate to describe a bit more about family fee allocation. Kate?
Thanks, Virginia. Good morning, everyone. My name is Kate Washington, and I'm a manager in Child Development and Nutrition Fiscal Services, or CDNFS. So family fee waiver allocations for fiscal year 2021-22 will be based on data submitted by contractors on June 2021 year-end reports. We will base these allocations on data received as of August 20th, 2021. So contractors that have not submitted a June report by August 20th will receive an allocation based on the most recently submitted and certified report. So just a plug to make sure that you get your June year-end reports in. And I'll go ahead and turn it back over to Virginia to continue to discuss budget changes.
Awesome. So on the continuing topic of state preschool 21-22 budget changes, one of the big things that was in the actual budget bill, SB 129, is state preschool expansion. So there's $130 million for local education agency, or LEA, state preschool program expansion. And so this is making the funds available for both part day and full day state preschool slots. And we're currently in the process of developing the RFA for this, and hope to release it in the late fall this year. And then Assembly Bill 131 also provides a $600 per child stipend for CSPP, with a 5% administrative allocation for those that operate a family child care home education network for CSPP. And so this is a flat rate stipend per child. There's also an additional flat rate stipend for all licensed facilities in the state, including licensed state preschool sites that DSS will be administering. So you can look for that from DSS. CDE will be issuing these $600 per child ones. And Kate will give you a little bit more detail on those stipends on the next slide.
Thank you, Virginia. The stipends are funded by the American Rescue Plan, or the Act of 2021, or the ARPA. There's a federal requirement that is tied to these funds, which is that fund recipients must provide information via a one-time application or survey in advance of receiving funds. We're therefore working on a survey that will be released to the field in the coming weeks. This survey will include questions dictated by the federal government, and the information that must be collected includes whether or not the program is open and how the program intends to utilize ARPA funds. It's our goal to release the survey in August and issue stipends in September. And I'll turn it back over to Virginia.
Love this tag teaming. So there are also a number of budget changes to state preschool in light of the transitional kindergarten expansion, which I'll talk about in a little bit. So first of all, the budget permits parental choice for TK age eligible children to be served in state preschool by changing the definition of state preschool eligible 4-year-old children. So it clarifies that children whose 5th birthday occurs after September 1st of the fiscal year, and if the parent or guardian so chooses, they can enroll or maintain their enrollment in state preschool and do not need to transition to TK. So this change also allows a CSPP eligible 4-year-old to enroll in TK for part of the day and state preschool for another part of the day, if the child falls into the TK age window and meets state preschool eligibility requirements. But that the child can't be at the same time, enrolled in TK and CSPP for the same, swath of time. We're working on developing a management bulletin to address the changes in age eligibility, but also want to direct you to an email that we sent earlier, I believe last month, that sort of had more directive while we're working on that management bulletin. Additionally, Trailer Bill also clarifies that TK enrollment does not impact family eligibility for a preschool or child care program including but not limited to Head Start. And finally, there's a piece about allowing state preschool to serve as a wraparound program for children in TK. And so all of these things will be our areas where we're working on guidance. So next slide. So one of the things we're really excited about in this budget, beyond the expansion of access that we just talked about, is that this budget addresses the rates, which have been such an issue for years in the state preschool program. So we know that our contractors and providers have struggled to stay open given the low rates. So we're still happy to share that one of the things that AB 131 does is implement reimbursement rate reform. So what does it mean for the rates? Generally speaking, reimbursement rates will increase in July with a COLA and then even further in January. And I'll turn it over to Kate to provide more details on these budget actions and let you know where we are with implementation.
Thank you, Virginia. So Assembly Bill 131 included an increase of 4.05% for the cost of living adjustment, or COLA, that was applied to the standard reimbursement rate, or the SRR. This increase will apply to both the contract's maximum reimbursable amount, or MRA, and contract rate. The full day CSPP rate effective July 1st, 2021 is $51.87 a day. While this rate increase is indicated in AB 131, the CDE is awaiting a revision to the budget bill, which will provide us with funding to apply these changes. Beginning January 1st, 2022, contractors currently receiving the standard reimbursement rate will be reimbursed at the greater of the 75th percentile of the 2018 RMR rate, or the contract per child reimbursement as of December 31st, 2021. At a high level, CDE will compare each contractor's current reimbursement, inclusive of adjustment factors, to the 75th percentile of the 2018 RMR. And as Virginia said, we know that rate reform for preschool contractors is long overdue, and you're all eager to know what your rate is going to be effective January 1st, 2021. We understand that knowing what your, or 2022, excuse me, we understand that knowing what your reimbursement rate will be is critical for budgeting purposes. Please know that we're working as quickly as possible on this analysis, and we will be sharing more information, including a timeline, in the coming weeks. And I'm going to turn it back over to Virginia.
Perfect. So to tie out our rate reform conversation in terms of future steps, the budget mandates that CDE and the Department of Social Services establish a working group that will assess existing quality standards and provide a methodology for establishing future rates. The goal is to sort of move even further beyond what's been done in this year's budget and consider, things like how to pay more for quality beyond just bringing the rates up to be equal across the system. The budget also requires the Child Care Providers United Union and the state to establish a joint labor management committee that will make recommendations for a single reimbursement rate structure by November 15th, 2022. So these recommendations are supposed to address quality standards for equity and accessibility while supporting positive learning and developmental outcomes for children. So the first bullet, stakeholder working group, will include state preschool contractors. So we're excited to work with the field as we think about how we can go even further with reimbursement rate reform and meet the needs of the field and the cost of quality. So I'm now going to turn it over to Kate for the next slide.
Thank you, Virginia. In addition to budget changes impacting fiscal year 2021-22 contract rates, we also want to share that AB 131 repeals Section 8265 of the Education Code, which effectively eliminates contract rates that are less than the standard reimbursement rate set in the Annual Budget Act. So what this means is that any contractor that had a rate less than the standard reimbursement rate in previous years will now receive a reimbursement rate of the SRR, which is $51.87 a day effective July 1st, 2021. And next slide, please. Thank you. So we've shared with you all before how excited we are with some of the changes we've made to the contracting process, which includes the allocation letter process. An allocation letter will be provided to contractors when changes to the contract do not have to be signed and returned to the contractor by the CDE in order for the change to become effective. So what this will include is amendments such as those that were required by law and enacted in the budget, such as the cost of living adjustments that we've been talking about. Some types of contract amendments will still require a signature, but we will make it very clear to the contractor whether or not a signature is required. And additionally, and regardless of whether or not the contractor is required to sign any particular amendment, we will continue to provide the contract face sheet and encumbrance information in the same format we currently do. And I'll turn it back over to Virginia to discuss TK changes and expansion.
Thanks so much, Kate. So transitional kindergarten, or TK as we call it, had a lot of changes and also expansion in the budget through universal transitional kindergarten. AB 130, which is the Education Omnibus Trailer Bill, provides substantial additional funding to support a phase-in of a universally available TK program over 5 years. So the first year is a planning year, and I'll talk about resources that are available for planning. And then the phase-in begins in 2022-23, where TK will be expanded to serve an additional 2 months of birthdays each year until TK is fully implemented and available for all children in 25-26. The trailer bill also sets forth new quality improvement conditions for TK, including reduced group size and adult to student ratios. Specifically, TK programs are required now to maintain an average classroom enrollment of no more than 24 students for each school site. And then starting in 22-23, maintain an average of at least 1 adult for every 12 students. And then the next year, if the legislature appropriates funding for it, that ratio will go down to 1 adult for every 10 students in TK. So finally, a couple other changes to TK. The trailer bill extends the deadline to meet TK teacher requirements an additional 2 years. So that deadline is now August 1st, 2023. And the trailer bill clarifies, as we said, that TK eligibility does not impact family eligibility for other programs, and that, you know, parents can choose, if they're eligible for those other programs, whether they want to send their kids to TK or those other programs. So next slide. So as I mentioned, the first year, this year, is a planning year, and the legislature and the governor have identified resources to support both the TK and the state preschool expansion. So there's the California Pre-Kindergarten Planning and Implementation Grant, which is going to be a $300 million grant that we're working on. Of that grant, there are really 2 components, almost 2 separate grants. There's a $200 million allocation that will go to LEAs that offer kindergarten, and they'll get a base grant of $100,000 and then more funding based on how many kindergartners they have and how many children that are eligible for free and reduced price meals they have. And then there's also a set aside there for county offices of education to provide county level planning pieces. And then there's a $100 million that will be a competitive grant for LEAs to apply to that is really intended to support the workforce. So it's a workforce grant program. So that is going to be a competitive grant application that we're working on both the allocation for the $200 million and associated guidance on the $100 million competitive grant program. But you know, these things take some time to work through the details of. So we'll keep you updated on the specific timelines of these as we move forward, and we'll have more to share next month at our webinar about our timeline. Then another resource is that the facility program that the Office of Public School Construction operates, which is in a department that's not CDE, it's in the Department of General Services. There's going to be $490 million available for a California preschool, TK, and full-day kindergarten facilities grant program. So this is $490 million for one-time grants to construct new facilities or retrofit existing school facilities for the purpose of providing TK, full-day kindergarten, and preschool classrooms. So this includes state preschool. So state preschool programs are eligible to apply. Funds can also be used to modernize classrooms to expand CSPP or TK. So we really want to make sure you're aware of these funds that the Office of Public School Construction will be administering. So look for more on that, and we'll continue to keep you updated there as well as they work on it. And then the last budget. So there are a lot of things in the budget this year and a lot of exciting changes to state preschool and TK. But one of those changes is the last two that we want to highlight are changes around the preschool learning foundations and the early math initiative. So the budget provided $10 million for CDE to update the California Preschool Learning Foundation for TK by incorporating recent research in the field, including best practices to better support dual language learners and inclusion of children with disabilities, and develop curriculum and educator resources to implement those standards and adapt the desired results developmental profile to reflect updated standards. And there's also $38 million for the California Early Math Initiative, which will be administered through the Fresno County Office of Education, consistent with the statewide system of support. So we're really excited about all these investments. We know this has been a lot of us talking about all the different things, but when you look at the architecture of this budget and know how much is there to support both the workforce and the families, it's really inspiring to think about the world that we get to live in moving forward. So I'm now going to send it over to Crystal for some updates from the Program Quality Implementation Office.
Thank you, Virginia. Hi, everybody. My name is Crystal Devlin, and I'm an administrator in the ELCD Program Quality Implementation Office. Excuse me. I will be providing you with updates on the requirements for reopening, reimbursement, and distance learning for fiscal year 2021-22, non-COVID-19 emergency closures, how to complete the notice of action, aka the NOAA, when a family has children enrolled in both CSPP and any other contract type that is transferred to the DSS, and the fiscal year 2021-22 desired results developmental profile, DRDP requirements. When you are required to close the CSPP due to a written public health order or guidance that are issued by a public health authority related to the COVID-19 pandemic and specific to early education and or childcare, you will be reimbursed at the lesser of 100% of the contract's maximum reimbursement amount, the MRA, or net reimbursable program costs. This includes when your program is required to close due to a confirmed exposure or positive COVID-19 test for staff, children, or families, and community care licensing or the local public health authority requires you to close. In either case, contractors will be required to offer distance learning services for children who are unable to receive in-person services. Additionally, if a public health order or guidance related to COVID-19 and specific to early education and or childcare limits classroom capacity and you are unable to provide in-person services for all enrolled children, you are required to offer distance learning services for those children who are unable to receive the in-person services. Guidance on distance learning plans and distance learning requirements is being developed, and we will issue this guidance as soon as possible. Be advised that these requirements are very similar to fiscal year 2020-21. What is not similar for fiscal year 2021-22 is that contractors are not required to provide distance learning services for families who are choosing to shelter in place. And the CDE requests that you encourage these families to return to in-person services as soon as possible so that their children are receiving continuous early education services. We have received a lot of inquiries about CSPPs that operate on a local education agency, LEA campus, where the LEA authority will not allow the program to reopen. Last year, when a CSPP was located on an LEA campus and the LEA authority would not allow the CSPP to reopen, contractors were held harmless. Assembly Bill 131 did not allow for this for fiscal year 2021-22. Therefore, if your program is located on an LEA campus, you will be required to reopen unless there is a written public health order or guidance issued by a public health authority related to the COVID-19 pandemic and specific to early education and/or childcare. If the LEA will not allow you to reopen the CSPP that is situated on the LEA campus, you will need to submit a program narrative change along with the revised fiscal year 2021-22 program calendar to your assigned regional consultant. This will result in a reduction to the minimum days of operation, and the contract's MRA will be adjusted accordingly. We are also working on guidance regarding non-COVID-19 emergency closures, and that should be released very soon. The requirements for requesting a non-COVID-19 emergency closure request will be the same as they were in fiscal year 2021-22, but we ask that you hold off on submitting a request until the MB has been released, as there will be an updated non-COVID-19 emergency closure approval request form for fiscal year 21-22 included in the management bulletin. Now on to the notice of action. If you have a CSPP contract and any other contract type that is transferred to the DSS, such as the CCTR contract, and a family has children enrolled under both the CSPP and another contract type, you will need to issue the family 2 NOAAs, one for the CSPP child or children, and one for the child or children enrolled in the other contract type. On the NOAA issued for the CSPP, include the CDE appeals contact information. For the NOAA issued for any other contract type, include the DSS appeals contact information. Finally, I will update you on the requirements for the DRDP for fiscal year 2021-22. CSPP contractors will be permitted to use the modified essential view of the DRDP this year. However, we strongly encourage contractors to use, at a minimum, the essential view of the DRDP, as this view includes a social emotional domain, and we feel that these are very important to observe and collect data on to inform the program activities for both groups of children and for individual children. Lastly, the CDE will allow contractors to complete the first DRDP within 90 days of the child's enrollment into the CSPP rather than 60 days. This guidance will be provided in a forthcoming management bulletin. As always, if you need additional programmatic technical assistance, please do not hesitate to reach out to your assigned regional consultant. Now over to our CDMIS team to provide you with updates to the CDMIS.
Jane, you're on mute.
Thank you. I have to unmute. Thank you, Crystal. Good morning, everybody. My name is Jane Liang. I'm the administrator for the Applied Data Research and Evaluation Office with the ELCD. And I'm happy to share with you our CDMIS change, the QRIS, the QRIS data field change. The quality improvement system initiated at both the state and the local level have been developed in California for more than a decade. Prior to July data collection, we only collect the QRIS participation information, not the QCC ranking. Now with this change, we are able to collect both participation and the QCC ranking information in one data field. The CDE began collecting QRIS information in July 2013 through the Child Development and Management Information System, or the CDMIS, the CDD 801A report with the 4 variables options in the data field. Next slide, please. So this slide shows the pre-existing QRIS options in the CDD 801A report. There are only 4 options to report. 0 for no provider is eligible but does not participate in the QRIS. 1 is yes, provider does participate in a QRIS. 7, the state has an operational QRIS in the provider's area, but the provider is not eligible to participate. And 8, the state does not have an operating QRIS in the provider's area. As you can see, these options collect the participation information only. With the change, we are able to collect the QCC ranking information. Next slide, thank you. Here I'm going to share with you why we need to change the QRIS field. In 2019, Governor Newsom signed the California Cradle to Career Data System Act into the law. The Cradle to Career Data System requires early learning data to include a child level, family level, site level, and agency level data that include the QRIS ranking. As you know, the 2021 Budget Act provides a preschool and a UPK expansion grant that requires the CDE to conduct comprehensive evaluation of the impact of preschool and TK programs. QRIS ranking is a critical element associated to the child where the learning and the care is provided. In 2011, only 49 sites reported the QRIS, but in 2016, there were 3862 sites. We have seen the number of sites meeting high quality measures increasing, and there is a need for us to collect this information. Capturing this data would be helpful for us to improve our programs as we strive for program quality improvement based on research and evidence-based practices. We want to use research as a part of our continuous improvement cycle. That is to use data inform us as well as the stakeholders to meet the needs of each and every child's needs. By expanding the options in the QRIS field, we are able to collect the QCC ranking information. Next slide, please. And we also want to, like I said, there was the, in the 2011, we only have less than 50 sites. Now we have 4,000 sites. So we want to reflect the growth in the number of the participating QRIS sites and to improve our data collection. And everybody knows this QRIS, the CDMIS is an old system. Make a little small change. It takes a lot of the effort on our end, but also ultimately takes a lot of the effort for the field to change the reporting. And also, like I said, we want to use the data to inform policy and guide field practices. Next slide, please. So with the same data field, we added a few options to capture the ranking, the side of the ranking. So in addition to the previous 0, 1, 7, and 8, we added the 1 through 5 and a 9. So the 1 through 5 is actually yes, provider does participate in a QRIS, and the ranking is 1 through 5. And the 9 is the state has an optional QRIS in the provider's area, but the information is currently unavailable at the provider's level. Next slide, please. This slide lists the resources that you may find at the CDE web pages. For more information on how to complete the QRIS field in the 801A report, please visit the QRIS 801A data definition page at http://www.cde.ca.gov/sp/cd/QRIS-participation.asp. For the CDMIS updates correspondence on the changes made to the field, please visit the CDMIS update issue 27 page at the www.cde.ca.gov/sp/cd/ci/update27.asp. I just want to share with you, this is a newer issue of the CDMIS update. The interval had been 2 years, so this is the first issue since the last update, the 26th. If you have any specific CDMIS or 801A reporting questions that aren't answered in any of these above resources, please email the CDMIS inbox at cdmis@cde.gov. This concludes my presentation. Thank you.
Okay, thank you so much, everyone. Now it's everyone's favorite time, the question and answer, and our small but mighty team has definitely been responding to you. So we do appreciate you here today, and we appreciate you working with us. So let's see, there have been a lot of folks who have asked about the DRDP requirements. I'm going to ask that Crystal just repeat what was spoken about on the slide.
Okay, in regards to the DRDP for this fiscal year, you will be allowed to continue using the modified essential view. However, we are strongly encouraging that at a minimum, you're using the essential view to be gathering observations and collecting data on the child's social emotional development. And you will also be allowed this year to complete the first DRDP observation within 90 days of the child's enrollment rather than the usual 60 days.
Excellent, thank you. I also saw a lot of folks asking about where to see slides and where to get copies of the slides. So for those who are new and for those who have been with us, we post our slides and a transcript and a recording of these webinars on our ELCD guidance webinar page. And that link will be with you at the end of the time. Also, do give us some space as we try to get those there. We have to follow our accessibility guidance while we're trying to get our transcripts. So we will get them out as soon as possible. Until then, you can always reach out to your PQI consultant for the information that was shared today. Let's see. There's also some questions about distance learning. I think that's still a very important question. And so I'm going to ask that Crystal come back. So there are some families that are still distance learning. Are we going to require them to come back for in-person?
So I think that would need more clarification. If they're choosing to shelter in place, you do not need to provide distance learning services for those families. And we ask that you encourage them to return to in-person services if you have capacity. The only time that you need to offer distance learning services is when your program is either closed due to the public health order or guidance, or there's a capacity limitation due to public health order or guidance, and you cannot provide in-person services for all of the children currently enrolled. And I hope that answers your question.
Thank you again, Crystal. So I'm going to call on Virginia for a few of these questions. So there's been some questions, Virginia, regarding will hold harmless. Is it still in effect? How is it in effect? Are there any MBs that are going to talk about this?
Yeah, so yes, it is in effect. That was the budget, all the budget details for so long that folks may have missed. It was the first thing I mentioned. So it is in effect. What this means is, so I'll just sort of repeat what I said there and then expand on it a little bit more. So what this means is that state preschool program contractors are going to be reimbursed at 100% of their contract MRA, of the contract reimbursable amount, or their net reimbursable program costs, whichever is less. And for that to be the case, programs have to be open and providing in-person services or closed due to a public health order. So those are the general requirements. And there's some additional days of closure for any state preschool program providers that are operating through a fetch-in. But for the center direct contracts, those are sort of the options. Either you're open and providing in-person services, or you are closed due to a public health order. In terms of guidance, we're working on guidance there. That's something that we know is something that you all are very interested in, and we will be issuing that. Overall, the pieces around this are very similar to last year, with the exception last year, the statute allowed a school district to require a program to be closed, and that was an allowable reason to be closed. And this year, that's no longer an allowable reason. But other than that, the statute is very similar. Crystal, is there anything you want to add on that?
Not at this time. Thanks, Virginia. Excuse me.
Okay, and Virginia, when we were speaking about the grants, there are folks that were asking, well, how can I apply? When can I apply? Can you give just a little bit of a foresight of how those grants are going to be working?
Sure. So I mentioned three different grants and one contract. So 4 different things that there's the state preschool expansion, which is you're applying through an RFA. We'll be releasing that information. So the best way to keep updated about the state preschool expansion is to be subscribed to our email distribution list, and we'll release information as we have it there. But in terms of the grants specifically, so there were 3 grants I mentioned. There was the $200 million for TK implementation planning, and sort of ramping up to get ready, get LEAs ready to expand next year. Then there's the $100 million in a competitive workforce development grant, and there was $490 million for facilities. So the first one, which is the $200 million, is not an application; it's an allocation. So the statute for the $200 million TK planning grant is very prescriptive. It says exactly how to calculate exactly how much goes to each LEA, and an LEA in this case is like a school district, charter school, county office of education that's operating kindergarten. And each one of those will get $100,000 as a base grant, and then more money based on how many children they have and what the characteristics of those children are. And then the county office's grants will be determined based on the characteristics of their county, how much is going to each of their school districts. So that one is an allocation. There'll be sort of paperwork that people will have to do to get the funds that we'll be releasing, but it's not an application. the 100 million workforce development funding, which is both for state preschool teachers, TK teachers, and kindergarten teachers, that is an application, and we're working on, we started work on that request for applications now. And again, the best way to stay in the loop about that, as there are more information available and the application is released, is through our distribution list and our monthly webinars. So we'll continue to update the field about those as we go through. And then in terms of the Office of Public School Construction's 490 million facility grant, that's actually not being administered by CDE. So I saw there were a lot of questions about, is this facilities thing allowable in the chat? And is this other facilities thing allowable? And that's really out of our jurisdiction. So we don't want to speak for a different state department. But as more information becomes available on that, we're happy to let you know. And I will say, if you're interested in sort of looking at the language yourself for these grants, so you can see what state law is requiring, you can read section 4 and section, and I'm going to put this in the chat of AB 130. So section 4 and section 15 of AB 130. Section 4 is where the 200 and the 100 million are discussed, and section 15 is where the facilities are discussed. So you can get more information from there.
Thank you, Virginia. There have now been a lot of questions coming in, and I know we're getting close on our time regarding sheltering in place and reimbursements and things of that sort. So I'm going to ask Crystal to step in and just explain a little bit as we're closing ourselves out.
Thank you, Alana. Yes, so for sheltering in place, there's been a few different questions. So one of them is in regards to disenrolling families who are choosing to shelter in place. No, families do have 12-month eligibility still, or the program year for Part Day CSPP. So you will not disenroll those families that are sheltering in place. Information is forthcoming from CDNFS on how to report those families. However, you again will be reimbursed at the lesser of 100% of the MRA or net reimbursable program costs. And then there was another question in regards to families who say they want to disenroll, and should we just keep them enrolled and mark them as, you know, sheltering in place. So for that, if a family provides you a written request to disenroll, then you can disenroll them and enroll another family in their place. But that is the only time that you should disenroll families. And I think that is it for now, Alana. Thank you.
Very important distinction for sure. So I'm going to ask Mai to move the slide ahead, and our team will continue to answer questions in the Q&A while I'm reading out where our resources are. So where our web slides will be, and management bulletins, and also all of the questions that we get in our Q&A, we are going to turn them into our frequently asked questions, and they will also live on the same website. And that is located at https://www.cde.ca.gov/sp/RE/ELCD COVID-19.asp. You can also submit questions to the ELCD emergency email inbox. That inbox is elcdemergency@cde.ca.gov. Also, to find your currently assigned PQI office regional consultant, please visit the website at https://www.cde.ca.gov/sp/CI/assignments.asp. Stephen, back to you to close this out.
Thank you so much, Alana and team. It does feel good to be kind of back in the swing of these webinars here. So as we close out our first webinar of this new fiscal year, thank you all for everything you're doing for children and families. We know that, as I mentioned earlier, that many of you are facing similar challenges as you'd seen at the height of the pandemic, with staff getting sick with COVID. Your strength and your passion helped us get through the worst of it, helped your families get through the worst of it. And we know it will help us get through this phase as well. So we want to thank you for your dedication, your commitment, and your love for this beautiful work. So thank you from the bottom of our hearts for everything that you do. As far as our next webinar goes, please look for an announcement on the next webinar, which will be in September. Until then, please take care of yourselves, each other, and we will see you soon.